The world according to your Soraya self.
Hey, wanna play?
Sure. Nah, we're good right here, thank you.
Don't let your Soraya self hold you back. Rather than play keep away because of red raised patches or flaking skin, shoot on over to your dermatologist and ask about Stelara.
Stelara is for adults with moderate or severe plaque psoriasis. Stelara may lower your ability to fight infections and may increase your risk of infections and cancer. Some serious infections require hospitalization. Before treatment, get tested for tuberculosis. Before starting Stelara, tell your doctor if you think you have an infection or have symptoms such as fever, sweats, chills, muscle aches, or cough. Always tell your doctor if you have any signs of infection, have had cancer, if you develop any new skin growths, or if anyone in your house needs or has recently received a vaccine. Alert your doctor of new or worsening problems, including headaches, seizures, confusion, and vision problems. These may be signs of a rare, potentially fatal brain condition. Some serious allergic reactions can occur. Do not take Stelara if you're allergic to Stelara or any of its ingredients.
Don't confuse yourself with your Soraya self. Talk to your doctor about Stelara.
Important safety information. Stelara is a prescription medicine that affects your immune system. Stelara can increase your chance of having serious side effects, including serious infections. Stelara may lower your ability to fight infections and may increase your risk of infections. While taking Stelara, some people have serious infections, which may require hospitalization, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses. Your doctor should check you for TB before starting Stelara and watch you closely for signs and symptoms of TB during treatment with Stelara. If your doctor feels that you are at risk for TB, you may be treated for TB before and during treatment with Stelara. You should not start taking Stelara if you have any kind of infection unless your doctor says it is okay. Before starting Stelara, tell your doctor if you think you have an infection or have symptoms of an infection, such as fever, sweats or chills, muscle aches, cough, shortness of breath, blood in your phlegm, weight loss, warm, red, or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate or urinate more often than normal, feel very tired, are being treated for an infection, get a lot of infections or have infections that keep coming back, have TB, or have been in close contact with someone who has TB. After starting Stelara, call your doctor right away if you have any symptoms of an infection. See above. Stelara can make you more likely to get infections or make an infection that you have worse. People who have a genetic problem where the body does not make any of the proteins interleukin-12, IL-12, and interleukin-23, IL-23, are at a higher risk for certain serious infections that can spread throughout the body and cause death. People who take Stelara may also be more likely to get these infections. Cancers. Stelara may decrease the activity of your immune system and increase your risk for certain types of cancer. Tell your doctor if you have ever had any type of cancer. Some people who had risk factors for skin cancer develop certain types of skin cancers while receiving Stelara. Tell your doctor if you have any new skin growths. Reversible posterior leukoencephalopathy syndrome, RPLS. RPLS is a rare condition that affects the brain and can cause death. The cause of RPLS is not known. If RPLS is found early and treated, most people recover. Tell your doctor right away if you have any new or worsening medical problems, including headache, seizures, confusion, and vision problems. Serious allergic reactions. Serious allergic reactions can occur. Stop using Stelara and get medical help right away if you have any symptoms, such as feeling faint, swelling of your face, eyelids, tongue, or throat, chest tightness, or skin rash. Before receiving Stelara, tell your doctor if you have any of the conditions or symptoms listed above for serious infections, cancers, or RPLS. Ever had an allergic reaction to Stelara or any of its ingredients? Ask your doctor if you are not sure. Are allergic to latex? The needle cover on the pre-filled syringe contains latex. Have recently received or are scheduled to receive an immunization, vaccine. People who take Stelara should not receive live vaccines. Tell your doctor if anyone in your house needs a vaccine. The viruses used in some types of vaccines can spread to people with a weakened immune system and can cause serious problems. You should not receive the BCG vaccine during the 1 year before taking Stelara or 1 year after you stop taking Stelara. Have any new or changing lesions within psoriasis areas or on normal skin. Are receiving or have received allergy shots, especially for serious allergic reactions. Receive or have received phototherapy for your psoriasis. Have any other medical conditions. Are pregnant or plan to become pregnant. It is not known if Stelara will harm your unborn baby. You and your doctor should decide if you will take Stelara. Are breastfeeding or plan to breastfeed. It is thought that Stelara passes into your breast milk. Talk to your doctor about the best way to feed your baby if you take Stelara. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Know the medicines you take. Keep a list of them to show your doctor and pharmacist when you get a new medicine. When prescribed Stelara, use Stelara exactly as prescribed by your doctor. If your doctor decides that you or a caregiver may give your injections of Stelara at home, you should receive training on the right way to prepare and inject Stelara. Do not try to inject Stelara yourself until you or your caregiver has been shown how to inject Stelara by your doctor or nurse. Common side effects of Stelara include upper respiratory infections, headache, and tiredness in psoriasis patients, joint pain and nausea in psoriatic arthritis patients, and upper respiratory infections, redness at the injection site, vaginal yeast infections, itching, urinary tract infections, and vomiting in Crohn's disease patients. These are not all of the possible side effects with Stelara. Tell your doctor about any side effect that you experience. Ask your doctor or pharmacist for more information. Please read the full prescribing information and medication guide for Stelara and discuss any questions you have with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.